I think most people go into medicine to genuinely help people, but we get caught up in this whole idea that thinking that pills and procedures are going to save the world. As an ex-pharmacist, I was totally bought into that concept. And ironically, we're often looked to for our opinion about recommendations for a healthy lifestyle. It's kind of ironic because as physicians, even those of us who are well trained, we're not really trained in health. We're disease specialists at best, technicians designed and given the tools of pills and procedures to try and solve the problem of disease. So if you ask us, what's the picture of health, what's health, most of us, if we're honest, we often don't know very much about health. And then coupled with the fact that because we're taught about pills and procedures and not taught about the importance of lifestyle, we really are somewhat clueless when it comes to, and not properly trained in terms of what I now have discovered is the most important foundational predictor for how your last 10 years of your life and how many 10 years of your lives you're going to have, which is lifestyle and nutrition. So doctors are in sort of a perfect storm whereby we're not trained in health. We're trained to heavily rely on pills and procedures, which although have a role, if you heavily rely on them and that's your only tool in the toolbox, inevitably you're going to do probably a lot more damage than you realize. And meanwhile, we're not trained in the simplest, the cheapest, the least side effect approach, which is getting people to focus on how their lifestyle choices will predict how sick they'll be. So hence we're very ill-equipped to face this battle which is facing us now, which is a whole culture of epidemic diseases which are basically based on lifestyle. So medicine really does need to, as many physicians are realizing, really does need, we need a short course in going back to basics. And not to say that there's never a role for pills and procedures in the right scenario. The right pill, for example, an antibiotic in somebody who's dying with a pneumonia, I'd like to think I've probably saved some lives with the proper choice of the antibiotic at the right time. And if somebody's leg is severed off, the right trauma surgeon at the right time could definitely save someone's life. There's a role for those scenarios and those tools, but you don't solve acne with a scalpel. So choosing the wrong tool for the wrong condition not only won't be helpful, it actually could be very destructive. So it's so not training physicians to be more aware of lifestyle is basically putting us on the front lines of disease management, poorly equipped to deal with this onslaught, which is now a whole group of diseases like diabetes, coronary disease, high blood pressure, obesity, which is all or almost all completely related to lifestyle.